All right, everyone. Welcome to GP Chat UK.
Oh, wow. Very first episode, eh?
It is. It is the podcast where we, as GPs try to figure out, what is actually going on in medicine these days.
It's changing so fast.
It really is.
Mm.
I'm your host, and I'm so excited to have you here with us. We're going to unpack all the exciting advancements, hot topics, all that, all the things shaping the future of healthcare.
That's right. And as GPs, we're right on the front lines, right?
Absolutely.
We're seeing it all. New information, guidelines, medications.
It's a lot to keep up with.
It is, yeah. So hopefully we can, break it all down, make it a little easier for everyone, for other GPs, for patients even.
Absolutely. Think of this as your cheat sheet for staying ahead of the curve.
Exactly.
So, for our very first deep dive, drum roll please, we're tackling a medication that has been causing quite a stir lately.
Oh, I know what you're going to say.
Mounjaro.
Mounjaro. Tirzepatide.
Yes.
It seems like it's everywhere these days, doesn't it?
It really does. Every patient is asking about it. Like, can I have some? Can I have some?
Headlines, miracle cure, all
there.
that.
Okay, let's get through the hype, right? What is the real deal with this drug? What makes it so special that it's got everyone buzzing?
Well, so originally it was approved for type 2 diabetes.
Right.
But what's really gotten everyone's attention is its potential for weight management.
Yeah.
It's not just another diabetes drug, It's actually showing some pretty incredible results in helping people lose weight. And we're not talking small amounts here.
Right, because usually we're talking about modest weight loss with diabetes medications.
Mm-hmm.
But with Mounjaro, I've seen reports of people losing like 20% of their body weight. That's a lot.
It is. It is a lot.
What's going on there?
So it all comes down to how it works. It's a bit technical, but bear with me.
Okay.
There are these two, switches in your body.
Okay.
They're called GIP and GLP-1 receptors.
Right.
They control both your blood sugar and how full you feel.
Mm.
Most diabetes medications only work on the GLP-1 receptor.
Right.
But Mounjaro, it flips both switches.
Wow. So it's like hitting two birds with one stone.
Exactly. You get better blood sugar control and significant weight loss.
That sounds almost too good to be true.
It does, doesn't it? And that's why everyone's so excited. The studies are showing really impressive results, particularly with weight loss. And some research even suggests it might be better at controlling blood sugar than other GLP-1 medications.
Okay, I'm starting to see why everyone is so intrigued.
Mm-hmm.
But, like any medication, there has to be a flip side.
Right, of course.
What about the side effects?
Yeah, so no medication is perfect. With Mounjaro, the most common side effects are the ones we often see with these types of drugs.
Okay.
Nausea, vomiting, diarrhea, that sort of thing.
The usual suspect.
The usual, yeah. But the good news is these often settle down with time.
That's reassuring. But are there any, more serious risks that we should be aware of?
There are a few, yes, but they are rarer. One is pancreatitis, inflammation of the pancreas. Now, it's quite rare, but it's definitely something we need to monitor, especially for patients who already have a history of pancreatic problems.
Makes sense.
What else? Another thing to watch out for is gallstones. This can sometimes happen with rapid weight loss. And then there have been some concerns raised about a potential risk of thyroid C-cell tumors. Now, this is mainly based on studies in rodents, so more research is needed in humans, but we do need to stay vigilant.
So, a lot to consider when weighing the benefits against the risks. Okay, so let's talk about who would actually be a good candidate for Mounjaro. How do we, as GPs, decide who to prescribe it to?
So right now, the NHS guidelines primarily approve it for type 2 diabetes.
Okay.
Specifically, when other treatments, like metformin or those other GLP-1 drugs we talked about, haven't worked well enough to control blood sugar.
So it's not a first-line treatment for diabetes.
Right. Not usually, no.
But what about using it specifically for weight loss? I know that's generating a lot of interest.
It is, yeah. It's a hot topic. And we are seeing more off-label use for obesity, but I think it's crucial to emphasize that this should be done with specialist oversight. Referrals to endocrinologists or bariatric specialists are really important in those cases.
Okay, so specialist referral is key for weight loss. What are some of the things we should be considering when deciding if a patient might benefit from Mounjaro?
Well, we want to prioritize patients with uncontrolled diabetes, of course,
Right.
and those with a high BMI and obesity-related health problems. Things like heart disease, high blood pressure, Those are the individuals who stand to gain the most from this unique approach that Mounjaro offers.
Absolutely. And of course, monitoring is going to be essential for anyone on Mounjaro.
Absolutely. Regular checks are vital.
What does that involve?
Well, regular blood glucose monitoring to make sure their blood sugar is well controlled.
Right.
We also need to keep an eye on kidney function, especially for patients who already have some kidney issues.
Makes sense. Anything else?
Yeah, we need to make sure patients know the signs of pancreatitis and to report any severe abdominal pain, nausea, vomiting immediately.
Okay, so red flags.
Exactly. And we should be regularly checking thyroid function as well, just to be on the safe side.
So regular blood tests and open communication are key.
Absolutely.
What about patient counseling? What do we need to discuss with people before they start Mounjaro?
Patient counseling is so important with any new medication, but especially this one. We need to make sure patients understand how to use the pre-filled pens correctly,
Right.
how to inject it, and we need to be completely transparent about those potential side effects, both common and serious. Really empower patients to make informed decisions about their health.
Transparency is key. What are some of the key things we should be emphasizing in those conversations?
I think it's important to prepare them for the nausea, especially in those early stages, but reassure them it usually subsides. We can also talk about strategies for managing side effects, like taking the medication with food, for example. Little things like that can make a big difference.
Yeah. Oh, excellent points. What about interactions with other medications? Are there any red flags we should be aware of?
Yes, definitely. We need to be particularly careful when prescribing Mounjaro alongside insulin
Okay.
because it can increase the risk of hypoglycemia, low blood sugar.
That makes sense. So dose adjustments might be needed.
Exactly. And in those cases, it's really important to collaborate with the patient's endocrinologist.
Right. Absolutely. Any other notable interactions?
Yeah, medications that affect how quickly the stomach empties, like metoclopramide or anticholinergics,
Okay.
those can interfere with how well Mounjaro is absorbed. So we need to consider that as well.
Right. So much to think about. It's all incredibly useful information, but, Mounjaro is still relatively new.
It is, yeah.
What does the long-term picture look like? What's on the horizon for this medication?
There is a lot of research underway trying to understand the long-term effects. The SURMOUNT studies are looking specifically at its impact on cardiovascular health, mortality, quality of life.
That's fascinating.
Yeah.
Are there any other potential applications for Mounjaro that are being explored?
Oh, definitely. Researchers are looking into its potential for, well, all sorts of things, actually. Prediabetes, non-alcoholic fatty liver disease,
Wow.
even polycystic ovary syndrome. It's really quite remarkable.
Wow, it sounds like this medication could potentially be a game changer for a lot of patients across various conditions.
It really does have that potential. But as always, we need more research. We need to fully understand its long-term effects and how to use it most effectively in different groups of patients.
So much to learn. It's an exciting time to be in medicine, isn't it?
It really is. Always something new.
It really is. Before we move on, though, I'd love to get your take on this. Mounjaro's price tag is pretty hefty, isn't it?
It is, yeah. Around 150 pounds a dose. That makes it one of the pricier diabetes medications out there.
That's a lot. So how do we balance the potential benefits with the reality of its high cost, especially when thinking about our patients in the NHS?
It's a tough one, isn't it? It all comes down to careful patient selection.
Yeah.
We need to be really discerning, We need to think critically about who will truly benefit the most. And there's a lot of emphasis these days on cost-effectiveness analyses.
Right.
Making sure we're getting the best value for the NHS while still getting the best outcomes for our patients.
So making those tough decisions and understanding the needs of each individual patient.
Exactly. Weighing the benefits against the cost, seeing if there are suitable alternatives. It's all part of the process.
It's a complex situation, for sure. Let's zoom out for a second, though, and look at the bigger picture. If Mounjaro delivers on all its promises, what kind of impact could it have on public health? I mean, overall.
Well, we're facing a global epidemic of obesity and type 2 diabetes.
We are.
So a medication that can address both of those, the potential impact is huge.
It's almost like tackling two major public health crises with one medication.
It is, yeah. If it lives up to its potential, it could significantly reduce the burden on our healthcare system over time. And not just here in the UK, but globally.
That's a powerful thought. I keep coming back to that cost issue, though. How do we ensure that this potentially life-changing medication is accessible to everyone who needs it, not just those who can afford it?
That's the million-dollar question, isn't it? Especially in the context of the NHS.
It is.
It's a conversation we need to have as a society. We need to figure out how to ensure equitable access to new treatments like Mounjaro. And that's going to require, well, a lot of things. Careful consideration, open dialogue, and probably some difficult decisions about funding, resource allocation.
Absolutely. It's not just a medical issue, is it?
No,
It's a social justice issue as well.
absolutely.
We can't ignore the potential of this medication to really improve people's lives. But we also can't shy away from these conversations about cost, about accessibility.
I couldn't agree more. Finding that balance between the excitement of these new advancements and the practical considerations of cost, accessibility, it's a challenge, but it's a challenge we have to face.
We do. This has been such an insightful discussion so far. I feel like I'm starting to really get a grasp on what Mounjaro is all about.
Me too, me too. It is a fascinating medication. It's been great to unpack it all the complexities and nuances. It really is a paradigm shift, isn't it, in how we approach these conditions.
It is. So what's next for Mounjaro? Like, what are the key things we should be keeping an eye on?
Well, the big one is FDA approval
Oh, right.
for obesity treatment, which, it's expected sometime in 2025.
Okay.
So not too far off. And that could really open the floodgates.
In what way?
Well, for similar approvals here in the UK and the EU, and then, potentially Mounjaro could become much more widely used, even in primary care.
So we might be seeing it prescribed for weight management even more often than for diabetes.
Exactly. And of course, those SURMOUNT studies are still ongoing. They'll continue to provide us with really important data on the long-term effects,
Right.
which will help us, refine our understanding of how safe it is, how effective it is, all of that.
Always good to have more data.
I know.
Right. Always. Always.
And it helps us make those informed decisions about how to use these new medications responsibly.
Exactly. And as we get more, what we call real-world evidence, we'll have a much clearer picture of Mounjaro's role in primary care and its impact on patients.
Okay, so let's bring it all together. For our listeners, both GPs and those who are just interested in learning more about Mounjaro, what are the key takeaways from our deep dive?
Well, I think the main takeaway is that this is a big deal.
Yeah.
Mounjaro is a significant step forward in how we manage both type 2 diabetes and obesity. That dual action mechanism
Right.
is really a unique approach, a really exciting one.
It's not just about managing symptoms. It's about addressing those underlying mechanisms that we talked about. Exactly. But, while the potential benefits are huge, we can't forget about the risks.
Of course.
Careful patient selection, monitoring, open communication about those potential side effects, all of that is absolutely crucial for responsible prescribing.
And we can't ignore the cost.
No, absolutely not. It's a major factor for patients, for the healthcare system as a whole.
Yeah, it's a real challenge. So balancing those potential benefits with the cost and, figuring out how to make sure everyone who needs it can access it. Those are ongoing challenges, but we have to address them.
Absolutely. And I think approaching these innovations with, enthusiasm, but also caution, always putting patient safety and well-being first. That's key.
Couldn't agree more. This has been so insightful. Thank you so much for joining me today and sharing your expertise on Mounjaro.
It's been my pleasure. I always enjoy these conversations. Medicine is such a dynamic field. Staying informed is crucial.
It really is. And for our listeners, I want to leave you with a thought-provoking question. Something to ponder.
Ooh, I like it. Go on.
Given that high cost of Mounjaro and the potential demand for it, how do we as a society ensure equitable access for all patients who could benefit, regardless of their, socioeconomic status? Something to think about.
It's a really important question, one that deserves our attention, our careful consideration.
It really does. And on that note, I think it's time to wrap up this very first episode of GP Chat UK.
It's flown by.
It has. It
Yeah.
really has. Thanks again for being here. Your insights have been so valuable.
It's been my pleasure. Really enjoyed our conversation.
And to all our listeners out there, thank you so much for tuning in. We hope you found this deep dive into Mounjaro informative, engaging, maybe even a little bit exciting.
If you're a GP or, you just like keeping up with what's new in medicine, we really encourage you to subscribe to GP Chat UK for more deep dives like this one.
We'd love to hear from you. What did you think of the episode? What other topics should we tackle? Leave a comment, let us know.
We're all ears.
Until next time, stay curious, stay informed, and most importantly, stay well.
See you on the next episode of GP Chat UK.
Yeah, it really has been. And I feel like, I don't know, we've only just scratched the surface.
Oh, totally. There's so much more to explore with this medication. I'm sure we'll be talking about it again, as more research comes out.
Definitely. But for now, think it's time to wrap up our very first episode of Drumroll Again, GP Chat UK.
Wow. It's flown by.
It really has.
Yeah.
Thank you again for being here. Your insights have been, like, so valuable.
Oh, it's been